Hello everyone, my name is Perry Lamb and I'm a first year health science student at SFU, and today I'm going to be talking about understanding cardiac arrest and its treatments. So what is a cardiac arrest? Cardiac arrest is when the heart suddenly stops beating. Without the heart pumping, there's no blood flow and oxygen to the brain, which causes loss of consciousness and can cause death if left untreated. I did a research article summary, and the article is called Out of Hospital Cardiac Arrest, 10 Years of Progress in Research and Treatment. And it's by 3 researchers from Sweden, and they focused on the science behind the mortality rate of cardiac arrest and its treatments of hospital care versus out of hospital. It talks about the possible reasons why the chance of survival is so slim, even with the years of research in treatments and prevention. I chose this article because cardiac arrest is the leading cause of death in Western society. The survival rate of an out-of-hospital cardiac arrest in Sweden is only 5 to 10%, not considering the variances in controlled environments such as hotels or clinics, and this can happen to anyone at any time. It's also interesting to compare the studies being done around the world to understand what individuals can do to help before pre-hospital care arrives. Continuous research is being done to find the best methods of prevention and treatment to prolong life. Some possible causes include non-cardiac cardiac arrests, including drownings, carbon monoxide poisoning, and overdose, and these are all external factors causing the arrest. Cardiac-related cardiac arrests, such as coronary artery diseases, arrhythmia, and cardiomyopathy, are all heart-related problems, so these are called the cardiac-related cardiac arrests. With the unknown probability of when a cardiac arrest will happen, CPR is the best treatment someone can give when an individual is experiencing an arrest. CPR alone is unlikely to save someone from cardiac arrest, but CPR mimics the pumping of the heart and keeps blood circulating in the body, restoring oxygenated blood to the brain and heart. It consists of 30 compressions and 2 breaths, but recent studies have shown that the compression-only CPR can also increase the chance of survival before medical help arrives. And this chart was shown in the research study, and it's basically the minimum coronary perfusion pressure. And the red solid line represents the CPP generated by the chest compressions, while the blue dashed line represents the minimum CPP required to carry oxygenated blood to the brain and heart. This is an AED, and when cardiac arrest occurs, the electrical systems are abnormal, which causes irregular rhythms or arrhythmias, which can cause it difficult for the heart to pump blood. So this device basically shocks the abnormal electrical activity back into its normal rhythm. And overall, there's been a lot of progress in the last 10 years. Increased CPR and AED training has improved. Hands-on CPR was deemed effective and increased the comfort levels of bystanders. Rapid response teams such as sprint units and ALS increased around the world. Telephone-guided CPR by dispatch increased, and Lucas machines, which are manual machines that help someone do CPR, increased. Increased cardiac health disease prevention also increased around the world. And so what is the best treatment someone can receive during a cardiac arrest? ECMO machines, or extracorporeal membrane oxygenation machines, is a mechanical circulatory support that pumps blood with an oxygenator. And according to the study from 2 doctors from Taiwan and Korea, the research that this machine, accompanied by the use of regular CPR techniques, has given the best results. Even patients with the worst prognosis had a 30% survival rate compared to the 19% with conventional CPR, AED, and medications used in hospital. And thank you for listening to my presentation. I hope you guys have a great day.